poll finds 16% of families in the U.S. are choosing to delay or skip recommended vaccines for their children. Here to talk to us about this is Dr. Simone Wilds, infectious disease specialist with Social Health. Good to see you, Doctor.
Great to see you, Dr. Wilds. So I want to read out some of the numbers, and so here they are. We'll put them on the screen so everyone can read out at home. 9% reported skipping or delaying the MMR vaccine, 9% for the DTaP shot, 7% for polio. So they're all under 10%, but nonetheless, why are so many people choosing to wait or even skip those shots?
Ed, it's a really great question. A lot of people are delaying or skipping the shots for a number of reasons. One, based on the adverse events that they get from the vaccines. There's also a lot of misinformation that's circulating where people get all their knowledge about vaccines, which tends to confuse them. And then based on the climate in which we live right now, I think there's a real mistrust of the healthcare systems.
What's the risk to delaying these shots? The kids are getting their shots on a different schedule.
Well, you know, Maria, delaying the shots really puts children at risk for getting severe infections, especially when they're most vulnerable. As a result of that, they could get a lot of complications, and long-term health outcomes can be bad, and sometimes there's even death. What I will say is that there is really no benefit to delaying the vaccines. I would really encourage everyone to follow the schedule that has been routinely tested to give the children the vaccine so they can get the protection they need the most.
And Dr. Wilds, the poll reported that most of those that are skipping or delaying the shots did so because of fear of side effects or, as you had just mentioned earlier, mistrust in health regulators. So boil it down. Boil it down to what your advice would be to try to assuage all those discomforts.
Well, you know, I understand the concerns, but I'm here to remind you that vaccines have been routinely tested. They've been safe. They're monitored closely. And also, you know, vaccines, there are some mild side effects which are very brief. But think about if you get the illness, it's way more severe. Vaccination is by far one of the most effective tools we have that can help to prevent severe prolonged hospitalization, even death. Prolonged illness, really something that we really need to consider, not only to protect ourselves, but to protect our community. So I'd really encourage people to consider using vaccinations.
All right, Dr. Simone Wilds, thank you so much, as always. We appreciate it. Thank you, Doctor.
Thank
Great
you.
to see you.